Hi, my name is Bill Bates. I'm an American who lives in Canada and has for over 30 years. And my purpose this morning is to dispel the myth that seems to be going around in the U.S. about Canadian health care. And this has been caused by a number of ads broadcast on the major TV channels, uh, political ads that have been broadcast to take shots at the congressional efforts to bring together some type of national health care for the American public, which I think is needed. Having said that, I'm not in the political battle. All I want to do is dispel the myth that has been created in most people's, U.S. citizens' minds about the bad Canadian health care, and it's a great Canadian health care. One of the cases that was cited on TV was a Canadian lady, Shona Holmes, who had in her mind to make a decision to go to the U.S. to take care of her cancer problem. And that was her decision. And there's no question there are some delays in the health cancer area because it's such a tremendous load. Thank goodness that Shona Holmes could pay the roughly $97,000 necessary to take care of her problem. Because if you think about it, 35 to 40 million Americans could not have done that. They would probably have died for the lack of health care, if you will. So let's don't take unnecessary shots at the Canadian system. With minor differences, the Canadian healthcare problem or healthcare system is handled by the various provinces of Canada. It's a provincial issue primarily that does have some federal support. Hospitalization, basic healthcare hospitalization, surgical procedures are all handled in the main by the healthcare systems of the various provinces. They vary a little bit about how you pay for them. Okay. But remember, 35 to 40 million Americans have no program at all, while over 35 million Canadians, all of the legal residents of Canada, are covered by some type of basic care. That basic care can be escalated through insurance. We'll talk about that in a moment. I have to give you a little bit of personal history for myself because I've been here, as I said, 30 years. During that 30 years, I've had 3 major critical surgical procedures done: broken hip, appendicitis, gallbladder attack. All that was handled very quickly within 1 day of the attacks or the broken hip. I've had one near critical surgical procedure handled just within the last 2 months that was handled within 1 week of the diagnosis, and that was adequate time in that particular case. I've had over 10 other minor surgical procedures done over this overall period, mostly on my sinuses and my nose. So I'm very satisfied with the way the Canadian system works. There is no government intervention in Canada between the doctor and the patient that's evident to patients in any case. I've never seen any case of that. We select our own general practitioner or GP. And yes, there's a little bit of shortage of GPs, but there are a lot of private clinics run by private doctors who can usually handle that issue. So there is not a big deal here. I'm speaking primarily from this point about Ontario because each province does handle it differently. Ontario is the largest province with over 7 million people, with several major urban areas, metro areas, the largest being the greater area of Toronto, which is something close to 3 million people. The area I live in, Ottawa, is approximately 1 million people. So the health care here is handled through, the benefits are paid for by, first of all, an employer health tax that pays, where the employer pays 1.95% of all remuneration over $400,000 a year. In other words, small businesses under 400,000 are exempt. That pays for all legal residents of Ontario, whether they're working or not. So if you lose your job, you still have your health care, if you will. That's been recently supplemented by an add-on to the provincial income tax of a small percent. I don't know what that percent is, but it's very transparent to me, the taxpayer, and I'm very willing to pay it, if you will. Yes, there are some delays. There are delays in many situations in both countries, I would suggest to you. And those delays tend to be in the heavy traffic areas. For instance, there are delays in getting joint replacements, knees, hips, and whatever. And there's been a lot of serious effort on the provincial part to take care of that problem, and they have slowly decreased that wait period. In cancer, yes, there are concerns because there's such a heavy load. Roughly 1/3 of North Americans are going to get cancer sometime in their life, and I don't care if it's an American hospital or a Canadian hospital, that's going to cause a load that has to be dealt with. And we are all working on that problem, I'm sure. So, I believe we have to think about dispelling this myth. I heard the Senate minority leader on CNN the other morning talking about the high quality care that the U.S. has. And there's no question, the U.S. does have high quality care. However, they should have expanded on it a bit and indicate that that high quality care is there for those who can pay for it, either through their insurance or their private means. In Canada, we also have high quality care, which is there for all legal residents. Thank you very much. I hope you've gotten something out of this. I'm not a political person, but I just had to say something. Thank you. Good day.